And thank you so much for joining us for this such an informational session by our esteemed speaker Renuka Hari today, and from all corners of India, from the USA, and from across the world. And before I introduce you to our speaker today, I would like to just walk you through about who we are, what Breast Cancer Hub is about, and just for 2 minutes of your time to take on this. So I'm Dr. Lopamudra Dasroy. I'm the founder and president of Breast Cancer Hub. And being a cancer research professor over the years, I've realized how lives we lose due to breast cancer or other types of cancers due to ignorance, taboo, lack of awareness leading to late detection, inaccessibility of healthcare facilities, accurate diagnosis and treatment. So all these concerns motivated me in 2017 to resign from my career and create Breast Cancer Hub as a pro bono full-time voluntary service to bridge the gap between the developed and the developing countries by providing sustainable solutions at the grassroots levels. So this is how we started off with Breast Cancer Hub, and just in a nutshell, what we do. So we basically we definitely stand against discrimination of color, religion, language, and culture and gender. We fight breast cancer in women, men, and LGBTQ community, and we support and fight other types of cancers too. So how we do that? Through early detection and prevention, through seminars, through different webinars, through informational videos. We develop early detection cards, and for example, we have this breast self exam card for women and for women, for men in 22 plus languages. So you can please go to the website and download the language of your choice and circulate in your network. So the other ways we function is we do community outreaches, we do population, because we go to the people and teach them the screening methodologies. And we any suspicious cases, we take accountability, we navigate towards the healthcare facilities and kind of like holding the hands of the patients, because the word cancer itself comes as a shock. So how we can help at every steps of their lives. So the other ways are we are the pioneer in adopting villages. We have adopted 11 villages in Assam, and we go door to door, provide screening, and like we have collaborated with the cancer hospitals. So starting from taking the suspicious cases to the hospital, taking care of the treatment aid. So we are doing all in all, because they are daily wage earners. They don't even have money to take care of their health. So providing a sustainable model for them. So that has been very successful, and we are planning to go to Upper Assam now. We are doing it in Southern Assam, and then also we are planning to start it in Bangalore once the pandemic gets over. So this is something that has been a very successful adopting villages. But while doing this, we have also been working on the different COVID-19 scenario, like providing food. Like we have provided, I think, more than 700 families food to, and then we maintain the database and we do follow-ups, we do food relief, because they, as I said, they are daily wage earners, and because of lockdown they have been struggling a lot. So that is another part. In the USA also we have been working a lot with the COVID-19 scenario, with the seminars we have been doing, making masks and starting from scratch. So other aspect is our support groups. For us, our cancer advocates, our cancer fighters are our heroes, and we publish their stories, which is inspiration for others fighting cancer. For me, like giving the scientific analysis, doing one-on-one, or we have different support groups, but our main integral support group is a very private WhatsApp group, and we do not discuss about it anywhere. So we function as one family, and globally we are connected with each other. On the research standpoint, I'm trying to do a lot of epidemiology study, a lot of clinical data analysis to tap into the untapped sectors in different provinces of India, and also doing a comparative study between USA and India, so that we kind of capture what is the underlying factor, so that we go into the bottom line and help with change in the healthcare policies. And our research is IRB USA approved and IEC India Ethics Committee approved too. So these are the different ways we are trying to accomplish our missions, and also through different leadership programs. So we have our ambassadors, our community leaders. So I mentor them, and then they kind of are the torch bearers. So I'm very proud of my students who are all across now, and they're leading the effort. So everyone is a volunteer with Breast Cancer Hub, and all our services are free of cost, and all donations strictly driven towards our mission. And we always believe that we save a life, we save a family. And that's who we are, and that's how we accomplish our mission. And I would like to thank you for being here today. And without further delay, I would like to introduce you to our guest speaker. And I cannot tell you how grateful I am to have Renuka Hari here, and who is a licensed massage therapist practicing in the city of Charlotte, North Carolina. She is a board certified at national level by NCBTMB since 2011. She has been practicing massage therapy for 13 years now, and in 2015, she also received her esthetician license to practice skincare. Having lost both her parents to cancer made her quite determined to get certified and pursue oncology massage to help people with cancer. To that effort, she is also an oncology certified esthetician qualified to give skincare services to those with cancer. She is also listed as a preferred practitioner with S40M Society for Oncology Massage. In June 2021, she is qualified to become an approved provider to teach other massage therapists about oncology breast massage, lymphedema, scar tissue, and myofascial release, and an additional class regarding ethics in oncology massage setting. She's very excited to teach, as this means that more therapists will have the knowledge and skill to help those with cancer, which is much needed. So, now you know why I feel so honored to have Renuka here with all these accomplishments. And we, on behalf of Breast Cancer Hub family, we want to welcome you, Renuka. And yes, over to you. So I will start presenting your slides, and thank you very much for your time today, Renuka.
Thank you, Lopa, for the wonderful introduction. And I'm also I feel very humbled because what you have done on a global scale is quite amazing. And I'm just a little drop in that bucket over there. So I'm very happy to help. And I just hope that, whatever I'm presenting today can help quite a few people. So our topic today is lymph management in the breast tissue, specific to this area, but I'll also be talking a little bit about the arms and how it affects that. A little bit about myself. Lopa has already spoken much, but I think the thing I'm most excited about right now is that I have become an approved C provider that's continuing education, and which means I'm now able to teach other therapists, and I'm planning on starting in September. So this means the more therapists learn the skills that are needed to work on the actual breast tissue, the more they will be able to help the cancer fighters and the survivors who are out there. And, knowledge is meant to be shared. And so I'm more than happy to do that. So I'm also a cancer aware comprehensive certified therapist. And so I've been doing this for close to 10 years now. And so I'm very excited to share. So let's move on to the next one, Lopa. So since it's all about lymph management today, so it's important to know what is lymph. So it is a fluid that is in the body. Over time, it actually drains itself quite effectively, but over time, if something happens to the body, it can become slow, heavy, sticky, which leads to much congestion. It's basically a metabolic waste. All the cells push out their waste matter once they're done with the metabolic activity, and it just sits there waiting to be drained into the lymphatic tissues and then to be picked up by the venous return back towards the heart. So basically, it is a sanitation system. So we have to keep all the drains and the plumbing system of the body clean and effective. Otherwise, it'll compromise our immunity. And where is lymph? It's everywhere in the body. And what are lymph nodes? Lymph nodes are clustered within the joints, and they're all dependent. They're all dependent upon the body's movement. And when we move, the veins pick up the waste matter from the blood, and they return everything back to the heart. And even all the lymph fluids eventually drain into the veins and are picked up by the blood and move back to the heart. And there's one-way valves as it moves back to the heart. So every time it moves from point A to B, the valves open up, things shoot up, and then the valves close. So that's how things move. But unfortunately, in today's world, the way we sit for long hours, swelling happens, backflow happens. Sometimes it causes varicose veins and things like that. And more often than not, it can also cause lymphedema. But the good news about that is it can be moved manually or even by using a device, and we call it stimulation. And what helps it is a two-prong action. One is the movement, the other one is hydration. So I cannot stress that hydration factor enough. So the next point, please. And what to know about lymphedema? Now, edema by itself is a swelling, but what is a lymphedema? Lymphedema is swelling because the fluid retention that happens because of an infection, blockage, or even a removal of a node or nodes. Now, it is a medical condition, and it requires a diagnosis by a physician. It can be chronic, last many years. For some, it can be lifelong, or it can even surface unexpectedly after many years, and nobody knows why. But there are some triggers, and you have to be very careful about this, especially if any of these apply to you. Main one, surgery, then sometimes in a biopsy, just like having a lumpectomy done can also trigger some lymphedema, especially if it was close to a lymph node at that point. Injury of any kind, heat, overexposure to heat, overexertion. And by overexposure to heat, I mean maybe you like to be gardening, or maybe you like to spend your day at the beach. Maybe you like, if you're somebody who's working out in the fields, doing some physical activity, maybe you're in the construction business and you are outdoors a lot. So that can also trigger lymphedema. Overexertion, and that can lead to overexertion even though we don't realize it. Restrictive and constrictive clothing. Now, some of the restrictive and constrictive clothing is actually meant to help the lymph flow, because every time we constrict it, the veins, it helps to push the blood through the veins and consequently the lymph as well. But if it's too tight, by what I mean by that is things like, say, watches, or your rings, or clothing like, say, socks that leave a mark on the body, or the bra straps, and the mark doesn't go away after a long time, say even after an hour or two, then you need to be concerned, and you need to wear much looser clothing in that case. And jewelry, especially rings, we notice that a lot. Sometimes overnight you find that the finger is swollen and the ring doesn't come off, or the watch strap suddenly became tight, or your bracelet or your anklet or something like that. Changes in elevation, that is something very common. A lot of people carry compression socks with them, and sometimes in age is also a factor in that. Not necessary that you be a cancer patient or have been or have had surgery. Sometimes tattoos can cause a temporary swelling, lymphedema, especially if it's been done very close to the area where the lymph nodes are. And excess body weight for some can be a cause for lymphedema. There is no cure as yet, but the thing is, it can be managed safely and effectively through constant care, attention, and stimulation. And that's what I'm going to show you today. Some techniques that you can use, not just for your actual breast tissue, but also what you can do long term, so that it is something that you need to keep at it. It's not just a one-day thing. It's not something that you can do just once in a day, but it is something that you have to do a few times a day in order for it to be managed effectively. So next one, please. So before we move on, I just want you to take a look at the structure of the breast tissue, and you can see how well the breast tissue is actually protected. It's got nodes on all three sides. So it's got nodes starting here in the underarm. It's got nodes that go all along here, following from the underarm to the collarbone, and then it drains down. And actually there are nodes right under here as well, and all over the abdomen area, although it's not shown in this picture. And here you can see a little bit more clearly how all this is. So if anybody is wearing an underwire bra, I would say not to, because those bras come and press right here against the nodes, and same thing over here as well. So it is advisable to not do that. For women, especially. For men, the thing is, it is mainly muscle. This is the pectoral muscle, and we have a pec minor over here, but it's mainly all the pectoral muscles, and they're sitting on top of the ribs. But for women, we have the pectoral muscles, and then the globular part of the breast tissue is actually fatty tissue. And one of the things that has been researched and found to be true is that toxins love fat. And that's where most of the cancers are found, like say visceral abdominal tissue or the breast tissue. And so that's why we see more and more cases of breast cancer coming up because of the fatty tissue. But unfortunately, nothing can be done. But prevention is always better than cure. So the more you take care of your breast tissue, the more empowered you will be to prevent anything happening down the line. So this particular webinar is also not just for those who have had cancer, but also for those who are seeking to find ways and means to take care of the breast tissue, because the more knowledge you know, the better you feel, the more empowered you are. It's also about not waiting for something to show up on a test result, but to be proactive about it now, so that you can take preventative steps towards that. So next one, please. So here are the breast strokes. Lopa, I just have a question. Are they able to see me? Because I'm not able to see anybody.
Yes, I think everyone can see you, or maybe I can, yeah.
It's okay.
Yes, ma'am.
Everyone can see. I can see you, and hopefully everyone can see, right?
Okay, because I can't see
I
anyone.
can see you. I can see you.
Thank you. Thank you for the feedback. Yeah. So here it is. I have put these tapes along here just to show how to drain that. So if you look at this first picture over here, where it's marked number 1, this is right along the collarbones. So that's what I'd like for you to feel. Figure out where your collarbones are. Now, for some people, it lies shallow. For some people, it's deep. And it doesn't matter. What matters is that you have a collarbone and you're able to feel it. So it all comes, and there's a little notch over here. That's your clavicular sternal notch right here. It meets up with the sternum, which is also called the breastbone. It lies flat, goes all the way down till the end of the ribs. And so that is how the lymph drains. So if you remember the picture of the breast tissue that I had shown, that's how everything will be draining over here. It comes up from the underarms, moves across the collarbones, and then starts to drain down here. So that's what we will be doing. But here is how, there's a peculiar way to move the lymph. We don't start from the area where the nodes are. We start from the area that's furthest away from the nodes. So we are going to clear this, and then a few strokes. I just want you to take a very soft hand. If you have the lotion or whatever, please use that, because the skin over here is very thin and turns pink very fast. So you apply something, some kind of lubricant to your hand, and then very softly, I want you to drag your hands along the collarbone towards the center. You can even push like this, one hand at a time. At one side at a time. You can even use both hands if you want, and just very gently, like you're stroking a baby and you don't want the baby to wake up. How gently would you do that? So you do about 10 to 15 strokes over here. You can do this above the collarbone or even slightly below. It doesn't matter. Either way, the nodes get stimulated. And then after we have done that a few times, then we are going to start. I would say start with the side that is not compromised for you. So just start to move. You're going to start from here, the shoulder joint, and move this way, feeling the collarbone and moving towards the center. Start from there. The slower it is done, the more you'll be able to feel. Again, the purpose is not to drag the skin. That's why we are using a lubricant, a medium of some kind. So we just want that glide to happen very naturally, very softly and smoothly. We do not want to drag the skin at all. So after you have done some 10 to 15 strokes this side, then we move on to the other side. And then lastly, we palpate the number 3, which is just under the arm. So we're just going to press up this way towards the neck and then release. Just press up and release. Press up and release. Up release. Same thing. Again, about 10 to 15 times. Slowly. This is not a race, no rush. This is about you taking care of yourself. Just press up and release, up and release. Now, what to do if the right side is compromised? So let me put some points just to show some random areas where the nodes could possibly be. So what to do if some of these areas are compromised? Now, obviously, you can still do it over here as long as no nodes have been removed from around this area. So you can still try and drain from this area. And of course, on this side, it is absolutely okay because this is the non-compromised side. But then what happens when you come to the actual global breast tissue? So because what has happened over here will affect what has happened, what would happen to your breast tissue per se. So you're going to push everything below after you have done the stroke number 1 and stroke number 2 and palpated number 3. Now you're going to come to the breast tissue and you're going to start moving everything this way towards the center. Again, 10 to 15 strokes on every side. And since let's say if this is a node that is here, I think that fell down. So let's say, so this is a node that's right here along the axilla, the underarm area, and that has been removed. So now it's possible that all these other nodes are now wondering how to make the fluid move without being overloaded. But here is the thing, you can help them by pushing things down and away. You don't have to push things along the side at all, along the pecs. You can push things down and around. And you don't even have to bring it around. You can even push it down towards your hips if you want, because that's also where the next bundle of nodes are. They're here right along the crease of your hips. So again, same thing. If you're wearing saris and things that are tight around the waist, please remove it. Please loosen that, because again, like I said, if anything is leaving a mark on your waist, and then that becomes a restrictive and constrictive clothing because it is not conducive to moving the lymph in an effective manner. So I would say to wear things, or say even the bands of your underwear or anything, or the bands of your bra, I would say to loosen up everything or take them off and then do these strokes. So this is the best way to do it. You're pushing everything this way. And then what if now this side were compromised, the opposite side? Let me put some over here. Moving to my left. So I'm now showing from my left side. So if the left side is compromised, I will still do the 1, 2, 3 strokes. That's always a starting point. Even if you forget to do number 2 and 3, you have to do number 1, because this is the chain that it follows from the underarm to the shoulders, to the shoulder and across to the center of the body. So this is what has to be done. So we again do a few, about 10 to 15 strokes here. And if you start to feel thirsty, that is a very good sign, because it means the cells have removed the waste matter and they're thirsty and they're hungry now. So that is a very good sign. So that's why I always say, keep some water handy. So it's a good idea to drink water first, do the strokes, and then again, drink water in between as well. So after you have done some strokes and palpated this area, now again, you're coming to the left globular breast tissue, start moving everything towards the center. It's a good idea to do all this while standing in front of a mirror so you can see, or if you can have somebody else stand there and hold a mirror for you, you can see. Try to do this in a sitting position, standing position, lying down, because the breast tissue feels different in different positions. When you're lying down, they tend to splay out, and then you can feel the chest opening up a little bit more, but you can also feel the sides. It might be a little awkward to pick it up when you're lying down, but you can definitely feel things differently in different positions. So again, just push everything down this way. Now, if you have difficulty moving your hands, that's why we go slowly, because sometimes all these get affected. the range of motion. We are not able to move as well as we want to. So move slowly. And if you're not able to do anything, let's say if you have some radiation burns and you're not able to do the strokes and just touching it feels too much, then I will say use a brush if you can. The hand is always the best. Okay, because your body recognizes your own touch. But if for whatever reason that is not available to you, use a brush. And what kind of brush to use? This is the kind of brush. This is a facial brush. It is super soft. You don't have to go running around buying it. If you have a makeup brush at home, you know, the kind that you use, it's called a kabuki brush, or kind that is used to apply the rouge onto your cheeks. That is the kind of brush you want to use. It has to have a little bit of a surface area to it. So use that. If you don't even have that, this is a baby brush. This is also super soft. And these two brushes you can use. You can even have a makeup brush, which I didn't bring down with me. So actually I do have one. Let me. Here is a makeup brush. This is the kind of brush that you'd like to use, or something close to it. If you don't even have that, use, you know how the men, they use a shaving brush to go around their face, you know, when they're lathering it up. If that is available, use that. But here is the thing, please don't share stuff that belongs to others. It's best to have at least 2 to 3 of these brushes, only because you'll have to wash it between uses. So every time you use it, it's picking up the oils, the lotions, or whatever you applied on your body, the sweat, the dirt, the grime, the lint from the fabrics and all that stuff, and gets trapped in the brushes, and that can breed bacteria, and the sweat, not to mention the sweat. So all that can breed bacteria. So the brushes have to be washed between each use. So in summer, it's okay. If you're doing that only in the morning and evening, it's fine. It'll probably dry out. But if for severely congested areas, you'll have to do this at least 3 to 4 times a day. So it's a good idea to keep 2 to 3 of these on hand, just so that you're not, just taken unawares, and don't use a wet brush. It needs to be dry. So that is an alternative, but I would always prefer the hands, because that way, just imagine how much surface area you're covering with your hand. This is quite a bit compared with, say, something like this. They're so small. So it's just, but that is just a suggestion. Lopa, if you can move on to the next one. So here are some do's and don'ts. Do check with your physician if using all these things is okay for you. Just please don't take my word for it. Doctors are the ones treating you, and they know what it is. Now, if you had come to me and you were lying here on my table and I see all that, I can suggest this to you, but I will still tell you this. Please run this by your doctor and see if it is okay. If they say it's okay, only then you go ahead using all this. Now, hydrate well, really well. The more water you drink, the more your body will push out the toxins. And if you're tired of drinking water, it's okay, absolutely okay, to have coconut water 2 to 3 times a day. It's alkaline. It's very good in pushing out mucus and healing the body from the inside out. Massage your breast tissue often, at least 1 to 3 times a day, depending upon how congested you feel. Now, you will notice a difference in as little as 3 to 4 days, okay? So you have to be patient with what you're doing. Lymph moves super slowly. It's like a clogged drain. So you just have to be patient with this, because there's no way you can rush it, because all this stuff has been there for some time. And so it's up to you. And it's only now that we're taking some kind of action about it. So you've got to be patient. It takes time for the body to get that message that, okay, yes, we're doing something good and worthwhile over here. So let's start to help that happen. And visually inspect your breast tissue often, standing and lying down for a week. Usually if the breast tissue is congested, it feels very puffy. It can feel very tender. And so touch your tissue often and see how it is feeling. Touch it during different times of the day. Look for the changes in size, your shape, the temperature. Are there any rashes that are coming up? And if you're not washing this brush often, the rashes can come up. So and you most certainly do not want that. Any unexplained bruising that has happened anywhere. So it's important to look at the breast tissue from all angles, and even underside. We often neglect the underside of the breast tissue, especially for women, because it's just hanging over there. Gravity is pushing it down. So you need to pick that up and really take a good look over there. That's why having another person helps, because when you're lying down, they can even hold up a hand mirror, and so you can see for yourself how the underside looks. Now, any nipple retraction is the nipples should be sticking out, but for whatever reason they're not, or one nipple is pulled in, that is called nipple retraction, and one nipple is out, please bring that to your doctor's attention, especially if it happens suddenly, or or you see it retracting over time and you're between visits. Make a note of it, the date when you notice this first, and bring it to your doctor's attention. Keep a separate little book or a journal just for this, for noting down all these observations. And puckering happens usually around the areola. It can also happen in the proper breast tissue as such. So sometimes when there's a water loss, like say the lymph has moved out, puckering can happen. So just make a note of that as well. And check the entire breast tissue, right from the collarbone to your diaphragm, which is here on the underside of your, right where the ribs are ending, and on the sides as well. We often forget that. We often think of breast tissue as just being here, the globular part of the breast tissue, but it's actually right from here and down. Keep a journal and chart it. Chart, how many times have you done this? What are the times you did it? And how did it look like? Did it feel tender? Is it less tender? Is it more sensitive? If so, on which side? Right side, left side? Is it here on the upper part? Like you can see the breast tissue, the actual breast tissue strokes screen. If you go back there, Lopa. Yeah, so you can see how I can divided the breast tissue into 4 parts. So it kind of makes it easy for you to track and keep track which quadrant. They're called quadrants because I've filled in 4. So it's quadrant. Which quadrant is the one that you are feeling the pain or sensitivity most? The more you track, the more likely you are able to catch something when something is off. If you've never touched things to begin with, how will you even know if something is wrong, right? So let's move back to do this, do that, and bounce, jump rope, use something. Don't wear a bra when you're doing these, because the more we bounce and jump rope or use a mini trampoline, which is also called a rebounder, the more the breast tissue gets to move, and the more it moves, the more it drains. We keep it tightly bound at all times, even at home, even if you're working from home. Wear a couple of extra layers if you have to, but keep the breast tissues unfettered. Basically, don't bind them. Practice deep belly breath. That is exhaling through your abdomen. So when you inhale, the belly actually comes out, and when you exhale, the belly goes back in. So that way you're activating your diaphragm. You're using your diaphragm to activate that. So when that happens, the lungs actually get more space to expand and collapse. And so when you keep the exhale longer than the exhale, the oxygen, body is actually having some time to make use of the oxygen. And actually 2 things happen. There is another little, maybe an organ, you can't really call it an organ. There is another little thingy that's right here at the base of your sternum and along the diaphragm. It's called cisterna chyli. And the cisterna chyli gets activated every time you do some deep breathing. And that is one of the things. So every time you exhale longer than the inhale, there's another thing in the body called the vagus nerve. That is the cranial nerve 10, cranial nerve number 10. That is one of the longest nerves in the body. It's called the wanderer because it wanders all over the body. So it can affect not just from your brain, but it also affects your eyesight, the jaw movements. It comes down the side of your neck. In a way, it's your heart function, which is also right where the breast tissue is. and it wanders down into your abdomen. So it is going right past there through your diaphragm. So, and whenever we, of course, whenever we have received a diagnosis like, say, cancer, body is bound to go into a stress mode. And so by breathing, we are able to activate the vagus nerve, which in turn activates the parasympathetic nervous system and brings the body back to calm. So that's why that breathing and meditation are so important. So even if you take 10 minutes of your time just to do breathing and meditation, and keep another 10 to 15 minutes just to do the strokes that I've told you every day, you're going to notice a huge, huge, huge difference. So next one, please. So this is the last one. So don't do this. Don't wait till something shows up on your health report. So be proactive, which is why we are doing this webinar, so that you can learn the skills and, play around with it and somehow make it your own. So don't press on inflamed nodes. If something is already feeling inflamed and you're not sure, call your doctor right away, and don't focus on just one area, but on the entire breast tissue. That's why we are starting the strokes over here. Then we move down here. And then when you're done, just do those little, the breathing, the belly breathing. So you can even keep your hands like this on your belly, one above the belly button, one below. So you can just feel the diaphragm move. And every time you exhale, you can feel the belly button moving back towards your spine. So it's pulling it in towards the spine. So that's a very good way of doing it. Don't do MLD, which is manual lymph drainage, if you're having any acute inflammation, any congestive heart issues, any certain autoimmune conditions, etc. Now, what I have told you is very general in a way, because I do not know what other health issues you're probably having, like say maybe blood pressure or diabetes or any autoimmune conditions, etc. So it's always a good idea to run everything by your physician before proceeding. One of the things that ramps up edema in the body is obviously salty foods, and all processed foods have hidden salts and sugars in them. So it's a good idea to have a very clean diet, as clean as is possible, eat fresh whole foods as much as possible. We all have our cravings, we are all ruled by hormones, and certain times of the month, we all want to reach for our secret stash of whatever we like best, but minimum, just portion control. That's what I say. You don't have to eat the whole packet, just a little bit. Avoid underwire bras, and I've already told you why, because they seem to dig in over here and press down on the nodes. And wearing it for 8 to 10, 12 hours a day, not a good idea. You want to wear it once in a while, like say maybe you're going to a restaurant for dinner, or it's a movie night or whatever, that's fine. Or a party you're attending, okay. But that's just a few hours, but not for such long lengths of time. And don't slouch. It's all about your posture. The more straight we stand, the way we are meant to stand, the more effective body systems work. So every time we slouch, we're actually compressing all the organs down here. All this is not moving. All this is getting squished. Everything needs space. There is space inside the body as well, and it all needs space to move and breathe and to work the way they're meant to work. So when we stand tall, we automatically breathe better. And when we breathe better, more oxygen, more nutrients, more of everything is going where it needs to go. And that is a very big factor in all that is. And it not just helps you feel better, it also minimizes the pain in the back of your body, because we are all looking at devices, sticking the neck out, or we are looking down. So it puts additional strain on the neck and the shoulder muscles. And believe me, that's all I seem to be doing, back, neck, and shoulders. People might be coming in for breast work over here, but invariably they'll ask, can you just take a look at my shoulder and neck, please? It's killing me. So yeah, so that's what it is. So don't slouch. Posture is everything. Okay. One of the things okay, let's move on to the next one. Okay, we are done. So thank you for your time. And one of the things that I do want to touch before I move on is, yes, this has been affected, but I spoke about how to decongest the breast tissue area. But one of the side effects that happens because of the lymph nodes having been removed is the swelling of the arm. And how to bring that under control is what I'm going to show now. One of the, and of course, that is again, you still have to do the 1, 2, 3, whether your area is affected or not affected.
Renuka, shall I stop sharing the screen, or you want the screen to be shared?
No, you can stop sharing if they've made a note of this info. It's fine.
Yeah, it's all being recorded. Yes, you can go ahead now because you were saying something about the next steps.
So yeah. So I was just mentioning that, yes, because the nodes here have been compromised, it's possible that, the arm, there may be swelling in the arm that happens. And that's very common. Most people notice more lymphedema happen over here in the arms than they do over here. Maybe because we're already used to this area being, kind of plump and soft. And so we're not noticing any excess fluids in the area, but we certainly notice it more over here. And if, people in India also tend to wear tight-fitting, form-fitting blouses. And so I think you feel it a little bit more because suddenly it's not fitting as much. And if it's leaving marks on you or it's not letting you do the kind of motions that the arm needs to do, then yeah, I would say switch to wearing something like a t-shirt and, just go about your work. You do not want anything cutting into this because that'll again prevent the lymph moving back. So how do you drain this area if the nodes are compromised over here? You start by bringing it over. After you've done stroke number 1 about 10 to 15 times, you do your stroke number 2. And number 3 might be more difficult because the nodes are not there, but you can start by bringing it up and above. And then you can start, I'm just going to use this kind of brush with a long handle just to show for demo purposes. So you can start by doing this, and then you start by moving it up. You can start by moving it up the arm and along the collarbone and towards the center. Come up the arm, along the collarbone towards the center. Now you can see that this is how slowly you need to do this. So if your arm gets tired, if you're going to use your hand and you're doing this and the side starts to get tired, please find somebody else to do this for you. But this one needs to be done at least 4 times a day. And you're going to do for at least 10 to 15 strokes at each point. So you can get tired very fast. And because if the arm is swollen, there's more surface area to cover. So, and this is not something like breast brushing. This is a very slow one because we are targeting only the lymph. So that's why the hand needs to be very soft. We're not targeting the muscles. We're not targeting anything else. It's just a lymph. So keep your hands soft. You can use a lubricant if you want to, some kind of medium to help the hands glide along, but it can be done and it will take time. So you've got to be very patient, and that's why you have to do it at least 3 to 4 times if you want to see some good results coming out of this. So now let's move on to some Q&A. Anybody, any questions for me?
Yeah, but thank you so much, Renuka. It was so wonderful. I'm sure everyone is going to agree. And yes, we are opening the webinar for question answers and more like interaction, any questions you have. Yes, Anamika, please go ahead. You all have to unmute yourself before asking the question.
You had mentioned about the collarbones.
Yes.
I've got this chemotherapy port. So can I do it on top of that? I avoid this.
You can do it under that. Where is, if the port is above?
Here. I mean, from the neck till, it's quite till this part, about 4 inches.
Yes, you can, because as long as the area has not been affected and you're still able to do it, you need to move this way.
This way, yeah.
Yeah. Or if this is where the chemo port is, then you can even start from here.
Below that?
No, closer towards the midline. You're going to come to the side of it, yeah, towards your midline.
From here. And, I don't have lymphedema because I've done the lumpectomy. But then, like I do the massages, which Lopa had shared an earlier video of yours, where you showed the massages. So like, I can't do it over the stitch areas. Like I have to go around that, isn't it? Because the lymph glands have been removed here. Then I've got a big, surgery here. So like, how do I do it? Just avoid that part?
You can avoid the part, and that is one of the reasons why I became a C provider, so that I can show people in person
All right.
how to deal with scar tissue in the area, because the scar tissue, when it starts to net up, it does not net up evenly. So it's kind of pulling on the tissue, and it prevents the drainage from happening properly. So that's one of the reasons. Yes, you can avoid, and you can go under that. Like I said, avoid if these are somewhere here, you know,
you go under that.
Yes, yeah. And let's put it here somewhere. Okay.
Yeah, it's in that 9 o'clock. Yeah.
Somewhere here.
Yeah.
You can still drain everything down.
Below, yes. I do that.
Yeah. And you can even drain everything this way.
Yeah, this way. Yeah. Like the hand, I move it this way. All right. With the fingers. All right. Yeah. Thank you. Thank you.
Any other questions?
I'm having lymphedema in my forearm.
Okay.
Is there any solution for it?
Yes, even if the lymphedema is in your forearm, you have to start over here, because this is the path it follows. So you have to drain here, then this will clear. When this clears, whatever is here will move up, and then whatever is here is moving up again. So it forms, when you start to drain over here, it creates an uneven pressure in the body. So things always move, fluids always move from an area of high pressure to an area of low pressure, okay? From an area of low pressure, no, area of high pressure to an area of low pressure. I'm saying it the wrong way. So so when you've drained all this, so now this area is low. So now this is a high pressure area, because that's where the congestion is. So all that will move up, right?
Okay.
And all this is moved up, then all this has no choice but to move up. But like I said, progress is very, very slow. And if that is how your arms are, then you have to do this action at least 4 times a day. Set a time every day and do it at that particular time, whatever, 9, 12, 3, and 6, or whatever it is as per your schedule. The more you do it.
I'm doing most of the domestic work with my hands, and I don't feel any pain at all.
But it's not the pain, it is the swelling that will slow you down because of the weight of it, the excess weight that you have to bear.
And this part is having some swollen, some solid mass is there as if.
Okay. So that's why I say always consult with your doctor. Yeah. That's why I always say to consult with your doctor and then to see whether the strokes will work for you. It will move, but it has to be done in a very consistent manner, just like you're training for a race or something. You've got to show up there at the time and do all these things every day at the same time.
Radiation
has to be done.
Okay, thank you so much.
Yeah, of course.
Renuka, I have a question, many times I come across these questions from the patients. So do you prefer any clothing? For example, here we get the arm tight, sleeves. Yeah, pressure sleeves. So I know in USA it's available, but do you have an alternative to suggest to our patients in India or other countries where we might not get pressure sleeves, So that would be helpful for our patients to know.
They can use, they can even use socks, actually. If you have the long socks that come up to the knees or something, you just cut off the other end where the toes are supposed to go in, and just see how that feels, when you're pulling it over. The thing is, in India, where it's hot and humid, it might stick to your skin. So what I always suggest is using something like this. It's a baby powder, but it's got natural starch. So this is something that can help. You just basically sprinkle some starch or some talcum powder, which doesn't have silica or anything in it, and then it'll help the sock or whatever will glide on much more easily and kind of form like a compression. So they might have to go down a size or 2, because the thing with compression garments is that while they are quite firm and tight around the skin, there's also a little bit of give to that garment. So as we move the muscles, so let's say you flex your biceps, the garment moves with it instead of cutting into the skin. So that's what, makes the lymph move that much faster. And so that's why they prescribe that. If even that they can't do, then I think the other alternative is to get the elastic bandages and kind of just wrap it around so that's overlapping and just go around it, but only in the area where that is affected. But I'm not sure how good that'll be.
How much time can we wear that sleeve?
That is usually determined by the doctor or by a physical therapist, and they usually say to leave it on 24/7 all the time. Yeah.
All the time.
Yeah, you take it off when showering, otherwise it's left all the time.
But they say that while sleeping, you will not use it.
That is not what they say over here. So that's why I say always consult with your physician, because it's different for each person. So it's best to do that. Yeah.
Okay.
Initially, when they start the treatments, at the very outset, they always have them wear that all the time, 24/7. Yeah.
Excuse me?
Yes.
When I sleep, it pains a lot. I had a surgery here, breast cancer. I'm not able to lift both my hands.
Okay.
I'm not able to lift. And when I sleep, my collarbone, my shoulder bones, both my shoulder bones, and below my neck, it pains a lot. I have a terrible pain. What should I do?
You have to start decongesting that area. So once the congestion moves out, because you see all that extra fluid is putting pressure on your joints and on your collarbones and everything. So once you start doing this action, and this is such an easy thing to do. You can do it, anytime, anywhere. You can do it while you're driving, you're stuck in traffic. You can do it while you're watching your favorite TV programs. You can do it while you're reading a book. You can do it while you're lying in bed. I mean, there really is no place where you can't do this simple action. You can do it while you're waiting for a pot to boil on the stove, So the more you do it, the more your body will get the message how to move. I mean, everything is in place under the skin. We can't see it. That's why I always show that video or that particular slide of how it looks under the skin, where the nodes are and what the structure is like. So the body is a very intelligent design, and you have to trust the process. It will take time.
It pains a lot here. It pains. It's terrible pain I have.
You can always have somebody massage your neck at the back.
And can I give warm water thing back here?
Yeah, it'll help to relax the muscles. It'll also bring a rush of blood to the area. It'll soften your skin also, and it'll help to move. Warmth is nice if you can handle warmth. Yeah.
And this arm also, where it has been operated?
Not where it has been operated. You have to stay away from the area. I mean, I cannot see how the state of that. When was the surgery done?
Last July.
So the scar should have healed. Yeah, the scar should have healed, but I would say no rough action around that area at all. Yeah. Just keep everything soft and gentle and move that. And if you want, you can, take to work on the scar tissue. Here's another thing. You take a makeup brush and let me put this on like this. Okay, so let's say this is the scar tissue. You're going to take this and you're going to move it away from there. So you're going to work on the sides of the scar, not directly on the scar, but on the scar.
I can do this. Can I do this?
Yes, but your hands need to be softer. Keep it softer. You see how your fingers are straight? They should not be straight. They should be slightly bent like this, soft. Not straight, but soft.
It is on your skin or on the cloth?
You can do it even over the cloth. It doesn't matter. You can do it on the skin. I would say first few times, please do it on the skin so that, you're touching your body directly, and, the nerves and everything get the message, to convey to the brain that what you're doing for yourself is good. It's helpful. It can even be calming because it's a very rhythmic way of doing it. So if you're going to use the scar, you work the scar tissue, you push it away from it, both sides. But if your nodes are compromised here, then I would say to push everything up and away into the collarbone, up and away into the collarbone. So
like this.
Mm-hmm.
Okay, yeah. Thank you.
Follow the this.
Yeah.
All, yeah. They try
So
very hard
Renuka,
to not affect this
sorry.
area because that's where most of the nodes are coming into and meeting up at this crucial junction. So they try very, very hard to never take out nodes from here unless something has been seriously affected.
Thank you so much.
I wanted to add one more thing, doctor.
Yeah.
That though it is 23 years after my mastectomy, full mastectomy right side, but even now, if I wear something tight, as you said, even a tight at the wrist,
Yes.
still I can feel the, the pressure like building up, and then it does swell. Because right now I had no swelling at all from the beginning, thank God.
That is wonderful, wonderful to hear.
Yeah, but now I want to tell everybody, even after all these years, if I wear a tight thing, I can't. It still reacts. It still reacts. So whether it is 1 year, 2 years, or 3 years, 10 years, I think the body, it still reacts.
It reacts, and that's what I mentioned. When I was talking about lymphedema in one of the first slides, that's what I said. It can come back even after many years. You might think that it's gone, and okay, I will do whatever I want, but no, you can't, because the nature of us is that we start to feel good, and then we try to catch up on everything that we missed out on, and so we overexert ourselves, and that overexertion is the one thing that'll again make it flare up. So it is always like, take things easy, do things at your own pace. Do not ever work at the pace of others. You do things per your way, what you are capable of, and only you know what you are capable of. So that's the best way to go about it.
I don't lift still heavy stuff on my right hand, even when I travel, the suitcase or anything. And even household thing, I don't do it on the right hand still after 23 years. I want to just tell them that, but I still continue to do my exercise every morning.
Yes.
And then activate the lymph nodes. I do 30 strokes under the arm. Though the lymph nodes are removed this side, but this side, I don't know if it's removed or not, but I do the 30 strokes. I just wanted to tell them that, and it does help.
It does.
30 strokes. Just pat yourself nicely, pat yourself everywhere.
Yes.
Pat your back.
It actually wakes up the body and stimulates the lymphatic system and the nervous system. Yes.
Even on the heart or on the diaphragm, on the navel, it's very good to do the patting because then you're activating.
Yes.
So I don't know. This is something which I do. So I thought I'd share it.
Yes, I've actually heard and seen a lot of acupuncturists suggest that, because it's a way that they follow in Asia to wake up their body and to stimulate, and to come out of that fog like state that you are in when you first wake up in the morning.
Even so when you feel that you're getting a heart attack,
you can hear the sound. You don't have to hit yourself, just enough to hear the sound of clapping that can happen. And it's a very
I do that. Yeah. When walking, it's very good exercise to do when you walk.
Yeah.
Especially number 8 walk. When I do all this hand exercise and this and that and this and that. Because there's nobody watching you, you do what you want to do. Nobody will think that you're a mental patient.
Make time for these.
I think we have a question from Meghna. Thank you so much, Uma ma'am, for your insights. That was really helpful. So I think we have to take a few questions. So Meghna, would you like to go next, please? I know.
Renuka, I wanted to ask about the compression sleeve. How tight should it be? Because if you suggest that we should be wearing it most of the time, it's usually very tight. It's a task to wear it. I mean, the talcum powder that you said to use it to put it up is fine, but it does help. It does wonders. In fact, I'm working now, and I put it on in the morning and keep it on for about 8 hours, and evening the pain's gone. But it's very, very tight, the compression sleeve. So any suggestion on that? What kind of size one needs to, purchase or try on?
I wish I could advise you on that, but I'm not a doctor, so I cannot. I'm a massage therapist, and
No, but as in how tight should it be? Should be like absolutely firm, or?
No, like I said, if it's leaving a mark on your skin and that mark is not going away even after a couple of hours after removing the garment, then you need to bring that to your doctor's attention. Okay.
This is with the compression sleeve as well?
Yes, the compression sleeve as well.
Okay. Doctor, I thought the sleeve is only one size. I have not heard so far of different sizes available, right?
No, they are available now. They are available now. Yeah.
Okay. Different sizes? Okay.
Yeah.
That's good to know.
Lopa, may I just pitch in? This is Dr. Sandhya Lopa.
Yes, Dr. Sandhya, please go ahead. Yes.
Renuka, with your permission too.
Yeah,
so a lot of our patients develop lymphedema, and we do advise them to wear their arm sleeves. And the kind of the gauge, of the tension in the sleeve is determined by whether it's grade 1, grade 2, grade 3, or grade 4. So for very early lymphedema, where people are just noticing a little heaviness and discomfort as they go through the day, we prescribe a grade 1 compression.
Okay.
And while it's a little more prominent, then it's a grade 2. But grade 2 is quite, it's not very comfortable to wear. Like someone was saying, wearing it for 8 to 10 hours a day is very uncomfortable. So, sometimes once the acute swelling comes down, then we switch again to grade 1. But what we are noticing is, and which I also want to clarify with Renuka, the kind of swelling that develops when it's soft, when the skin is still compressible, this massage works well. What about situations where some of them have a little firmer swelling? You cannot get, this skin to compress. Does massage, in your experience, have you found massage to work there and kind of bring down the swelling in those patients?
Yes, it does. But like I said, that kind of firmer kind of swelling just shows that the swelling has been there for a longer time and it's penetrated the deeper tissues of the body. So it will take, again, that much longer for everything to move out. So the only way to do that is to do it as often as you can, at least 3 to 4 times a day, and to be absolutely consistent in that. You have to set the time aside, at 15 to 20 minutes aside, and you work it, or you have somebody else do it for you. But it will happen, the change will happen, but you've got to be patient. You can't expect something there for a long time to just vanish in a few sessions,
So it's just from our point of view, to advise the patients, just to be persistent with that massage technique.
And patience, and to always be positive that yes, it will happen, because you are doing something good and beneficial for your skin, and the body recognizes that. The brain is the body itself is an intelligent design, and it will recognize that. And the more they practice the deep breathing, the more they're activating the parasympathetic nervous system, the more the swelling and inflammation goes down slowly.
So we actually treat, we teach these patients how to do the deep breathing exercises also. But to answer the question about, the arm sleeves, to the lady who asked about it, we do get different grades of compression. And as the treating doctor, they would advise, depending on the kind of edema, what grade of compression the patient needs. And it's very often they may have to switch between the compression grades. They have to move on to different grades as time passes.
Yeah, that makes sense. Absolutely.
Yeah.
Thank you, doctor.
Thank you for your input. I like that.
Yeah. Thank you. Thank you, Renuka. That was a useful session.
Thank you, Dr. Sandhya. Yeah, any other questions?
Just one more question, Lopa and Renuka,
yes,
which came to my mind. So we get good arm sleeves here. Nothing fashionable, the same boring brown ones, but I think you have very nice ones in the US. I've seen some pictures of, there's some site called Lymphedema or something. They have very nice, stylish ones, which, if you're going to have lymphedema for some time, then you may as well, use those to your advantage. But when you say massage 3-4 times a day, if the patient is wearing the arm sleeve, can they do it with that? It's going to be uncomfortable. But if they have to take it out and put it in again, it's quite a task, isn't it?
But I always feel that it is a worthwhile task, but that's why I always leave it between the patient and their doctor to decide that. But even if they're not able to take off the sleeve, at least if they're able to do this here, like I said, it's that area of moving from high pressure to the lower pressure, that will keep on happening. But even if you're wearing a compression sleeve and then you're not even moving your arm, but you're kind of holding it and being, kind of defensive about it, that's not going to move the lymph. Lymph will move only because of movement, arm movement, and the contraction of the muscles and the hydration. So all these three things need to happen in order for things to move. So just wearing the compression sleeve and expecting it to take care of the lymph is a little, kind of unrealistic. So they just have to keep in mind that the movement needs to be there at all times, and the hydration too. Because if they're sitting for long hours in front of a computer, then obviously you're not going to feel thirsty. We feel thirsty when we are active and we are busy and moving around here and there, hustling and bustling. But when we are sitting in one place, not really much of a reason to be reaching for a daily quota of water.
Yeah. So also I have a question, Renuka, for you. Yeah. And so basically, when we are talking about the compression sleeves, right, and doing this exercise, the strokes that you have shown, so wearing the compression sleeves, and can we still do the strokes? Or at that point, we have to take off the compression sleeve and keep it all relaxed and then do the strokes? Because
the strokes here can be done, and even over here. Yeah, so if you feel like you cannot move the strokes, you can even at least press and release, press and release, press and release, because that way also you're squeezing the muscle a little bit, right? When you kind of just give a very gentle compression and release. Mm-hmm. So you just have to start from here and then make your way slowly down. But each time you press about 10 to 15 times, then you make your way down, then you move to the back, then you move to the front. But each and every place is like 10 to 15 of those. And so that's what it takes some time. And you have to set aside that time for it if you want to see some really good results.
Okay.
That's
okay, that's wonderful. So Dr. Sandhya, I know that, in India, compression sleeves are ready-made as much as not available might be, but do you have any resources where, we can navigate our patients and they can get the compression sleeves from there? That would be very helpful, if you can share with us.
Yes. Yes, I'll definitely share it. We have one company which supplies us. They have different categories, so we mainly they have very good cotton sleeves because of the weather here in India. Yeah. Uh-huh. Synthetic is very difficult to wear. So the cotton sleeves are good, but again, the discomfort of wearing something tight. So yeah. It's something they have to kind of use at the beginning to get the best results. So we encourage all our patients to wear it as soon as we notice swelling. Okay. I'll definitely share the contact with you, Lopa. And they are ready to supply it across India. So that'll be good.
Okay, awesome. So I will also share it in our support group and also when anyone reaches out to me through one-on-one. Thank you so much, Dr.
Sure.
So thank you all for attending. I appreciate your questions. Very smart, intelligent questions by everyone. And thank you for sharing your stories also with me. That really helps. And I can't wait to get started on teaching so that, more and more therapists across the world. In fact, I was just discussing this briefly with Lopa that I would love to accompany her and, and do a live demo on some people, across cities or wherever she chooses, so that, people can see how it is to be done. And so, and
that'll be really nice. Are you planning to come to India soon? In the middle of all this COVID business?
Exactly. No, I'm just waiting for things. Trust me, I want to come so badly, but yeah, I think it's best to wait for a while. Yeah.
And also, Renuka, I know you mentioned that you needed, like in Charlotte, you were thinking of having some, if anyone would like to volunteer because you have to teach some students. So something like that you mentioned. Would you like to share here?
Yes, of course. Yeah. So if anybody is here in the Charlotte area and still listening in, then and you want to be a demo body or be a volunteer body so that the students can practice on you, I will be there and I will be, teaching them and guiding them through the process. So, it's not like just some random person doing things on you. I'll very much be here and, so, and that way I'm planning on doing the classes 2 times a month. And so you can come and get work done twice a month, and you can give your feedback, how it's made you feel. Did you feel any relief? Did how was the pressure? And help the students so that they can also better their skills, and I can also tweak my teaching so that it is more effective on many levels. So yeah.
All right. So I think we don't have any more questions. So we are almost ready to close the session. And yeah, thank you so much, Renuka. Like, it's been amazing. Like, we have learned so much from you, and I'm sure Dr. Sandhya will also agree that these are small tips, and we couldn't have done this without you. And I know that there was a huge request on the lymphedema webinar, and I have been getting it, and that's why I wanted to organize this so that globally our patients benefit from you. And thank you for letting us record the session, so which I'm going to share via email with everyone, so that with the new patients also we can share, and they will learn, so that the earlier we start with this, the better it is, right? So it will help all the patients. So saying that, I would like to thank each of you here on a Sunday morning or night. You have joined us. Thank you, Dr. Sandhya, for joining. Thank you to all.
Thank you.
Thank you for organizing this and for doing a fabulous job. Thank you.
And yes, I would like to take you now. So thank you very much. And please look forward for the recording session that I'll share in our support group and our website. It will be there. Please go to our website, download all the educational materials, share in your network. We have so many early detection cards for all type of cancers now, so please leverage that. And because the earlier we detect, the better it is. Thank you so much. And thank you again, Renuka. That was so important. Thank you. Bye. Take care, everyone. Bye.
Bye.
Thank you all.
Thank you. Thank you for attending.
Thank you for attending.
Thank you.
Thank you, everyone.
Thank you. So nice to see you.
Good night.
Bye. Bye, Mama.
Bye.
Bye, Padmini ji.
Bye.